It is the 25th of July, 2016. I am Ralph Turchiano, and I'm here to bring to you the top 3 health headlines of the past 7 days. Starting up with number 1. To protect yourself from malaria, sleep with a chicken next to your bed. That's a legit title. For the first time, scientists have shown that malaria-transmitting mosquitoes actively avoid feeding on certain animal species such as chickens using their sense of smell. Odors emitted by species such as chickens can provide protection for humans at risk of mosquito-transmitted diseases, according to a study in the Open Access Malaria Journal. We were surprised, as the researchers, to find that malaria mosquitoes are repelled by the odors emitted by chickens. This study shows for the first time that malaria mosquitoes actively avoid feeding on certain animal species, and that this behavior is regulated through odor cues. Incredible research. Now we can move it to practical application. This can save untold number of lives around the world. Number 2. More than half of U.S. doctors are now rationing health care, according to a survey. More than half of U.S. physicians, including a national survey, have withheld certain medical interventions with small benefits from their patients because of the cost implications these hold. These include deciding whether to prescribe certain drugs, ordering a scan to be performed, or repeating a laboratory test. Of the 1,348 respondents, 53.1%, reported having refrained in the past 6 months from using specific clinical services that would have provided benefit in regard to patient care because of the cost. Remember a few years ago, this is something we said would not happen? Well, it's happening. Prescription drugs and the ordering of magnetic resonance imaging scans were most often rationed by 48.3% and 44.5% of respondents, respectively. Something to keep in mind the next time you have to go visit your doctor. Number 3. Researchers find that cinnamon turns poor learners into good ones. This is an incredible impact on regard to learning, at least in an animal model. Cinnamon acts as a slow-release form of sodium benzoate, said the researchers. The lab studies show that different compounds within cinnamon, including the cinnamaldehyde, which gives the spice distinctive flavor and aroma, are metabolized into sodium benzoate in the liver. Sodium benzoate then becomes the active compound, which readily enters the brain and stimulates hippocampal plasticity, meaning it makes it work better in layman terms. Get ready for this part. The increase in learning in poor learning mice after cinnamon treatment was significant. For example, poor learning mice took about 150 seconds to find the right hole in what's called the Barnes maze test. Ready for this? On the other hand, after just 1 month of cinnamon treatment, the poor learning mice were finding the right hole in this maze test within 60 seconds. Now, that is an incredible impact in regard to an animal model. This carries through to humans. Cinnamon is going to be a student's number 1 best friend. Again, that was the top 3 health articles of the past 7 days. I always appreciate you listening, and I'll catch you all once again next week. Thank you very much, as always. Catch you next week. See you then. Bye.